Hello, this is Dr. David Green, CEO of the Georgia Pain Network. Today's topic is what you need to know about epidural injections. An epidural injection is an outpatient procedure that involves steroid and numbing medicine being put into the epidural space. It's designed to relieve the pain from pinched nerves. The epidural space is the area around the spinal cord where the nerve roots come off. So the injections do not go into the spinal cord, they go around it. So what are the indications for an epidural injection? First and foremost, you have a herniated disc, which is leading to sciatica. So you have, this is actually a disc bulge, but end up with the same type of thing where you have pinching of a nerve root as it comes off from the spinal cord, okay? And that can lead to inflammation and sciatica. Spinal stenosis, on the other hand, is when you have degenerative arthritis that leads to bony and soft tissue overgrowth, and that can pinch on multiple nerve roots as they're trying to get out from the spine. Also, compression fractures can cause inflammation in the area of the fracture and cause pain around a nerve root. And you can have a tear in a disc from degenerative disc disease, and that can lead to sciatica from irritation of the adjacent nerve roots. There are three different types of epidural injections. The first is an interlaminar epidural. You can actually see that here. Basically you have, here's a spinous process, here's a spinous process. Those are the bumps you can feel on your back, okay? Then you have this bone called a lamina, and you have this one called the lamina. So there's a soft tissue space between there called the interlaminar space. That's where the needle goes for the interlaminar epidural. It goes through that space, through some soft tissue, and then when the pain doctor feels a loss of resistance, that means he or she's in the epidural space, and that's where the injection goes. That's the injection that was invented back in the 1950s, and it's still very popular today. The newest type of epidural injection is called a transforaminal epidural. So normally for the interlaminar, you would put the injection here, right? Now for transforaminal, this is where the nerve roots come out. It's through a hole called the foramen. You can see one here, you can see one here. Basically, the newest type involves putting the needle close to where this nerve root comes out, because that's really usually where it's getting pinched, okay? So the steroid and numbing medicine is placed closer to the point of actual pinching, and the results with that have been exceptional. The third type is called a caudal epidural injection. So at the very bottom of the lumbar spine, you have the sacrum, and then there's an opening here called the sacral hiatus. That's where the needle goes for a caudal epidural. A larger amount of numbing and steroid medicine is injected, and it migrates upward, and it can relieve the pain from multiple nerve roots getting pinched at several levels. Okay, so that makes it great for something like spinal stenosis. Epidural injections are outpatient procedures. They take about half an hour. Usually the patient gets local numbing around the skin and soft tissues down to the area, and some patients need IV sedation, either from claustrophobia or they've done well with it before or for being timid, whatever. It can help. Real-time x-ray is used called fluoroscopy. You can actually see the machine here. It looks like a big C. People call it a C-arm, okay? And you can see a real-time x-ray view so the pain doctor can be much more accurate. For the interlaminar technique, it comes down to that loss of resistance where you go through the soft tissue, feel loss of resistance, and the pain doctor with the x-ray machine will know that he or she's in the right place. Dye is typically injected to make sure the positioning is accurate. And patients go home the same day within about an hour after the procedure. How well do they work? There have been dozens of studies looking at epidural injections. Results overall are between 75 to 90% good to excellent outcomes. One may need a series of injections, probably 3 of them over a 6 weeks period for maximum benefit. Numbing medicine works immediately and then it wears off, and usually the steroid kicks in within 2 to 3 days, and it can work for a few days to a few months at a time. The risks of epidural injections are small but real. There's a risk of an infection, bleeding. You should stop your anti-inflammatories 5 to 7 days ahead of time. Could have an allergic reaction. There could be side effects of the steroid that are usually transient. Unusually, there could be a nerve injury. The worst risk is that they just may not work. The complication rate overall is less than 1%. Are they FDA approved? The answer is no, and this is not a bad thing. They are FDA approved for other things, but It's just that nobody spent the tens of millions of dollars to get them FDA approved for use in the spinal canal. There's a reason they've been used since the 1950s, okay? Medications, 40% of medications are used off-label all the time. Here's 3 examples. Neurontin is an FDA-approved medications for anti-seizure, but it's used off-label all the time for nerve pain and migraines. Lidoderm is an FDA skin patch for shingles, but it's used all the time off-label for back pain and other numbing needs. Propranolol is an FDA high blood pressure medication, but it's used frequently for performance anxiety. So that's what I'm talking about, and that's why it's not a bad thing. The top non-operative pain management in Georgia is through the Georgia Pain Network. There are several clinics throughout the state, over 10 of them in fact, accepting over 50 insurances and providing over 25 treatment options with the board-certified doctors. Visit us online today at georgiapainnetwork.com and then call us for more information and scheduling at 404-850-9099. I'm Dr. David Green with the Georgia Pain Network. Your pain stops here.